I'm Dr. John Berg. Thank you for inviting me today. Okay, not only is this like a little bit vital, but we're going to be saving the world through education, because one of the things that most people don't know, I mean, the world is sick, but what avenues do we have to tell people the truth, tell people that there's a light at the end of the tunnel? YouTube's, it's only been around for about 11 years, and you're talking second largest search engine. Now, has anyone ever utilized YouTube to learn something?
Oh, yeah.
Yeah, yeah, I was given a live turkey for Christmas. It came in a cage. I had to YouTube how to dispatch a turkey, which was scary. Okay, yeah, you better get them in plastic or turn vegetarian. Okay, now half the YouTube viewers are on mobile devices. So if you're sitting in the airport, or what type of education can we put out there? Now, we know, and this is some stats and facts, and I'm going to give you all of these slides, by the way. Okay, I'm going to give you all the PowerPoints. In fact, I'm going to give you each doc in here. Okay, 3 of my PowerPoint slides. Okay, I'm going to give you one on Hashimoto's, a Graves' disease, how to correct high blood pressure, how to reverse arthritis. Use them. They're your present. I'm going to give you this one too. But right now, non-communicable diseases. This is going to wipe out economies of the planet. Now, these are diseases that you don't catch. You've got to earn. Okay, now, asthma. Now, I'm speaking to a group of some of the highest quality doctors on the planet. How many people in here have gotten patients in with asthma? What's the best treatment for asthma? Adjustments. Yeah. Do your patients know that? What's the best treatment for allergies? Do your patients know that? Okay? So this is getting you out of your comfort zone. This is not a nice option. These are lives on the line. This will not only wipe out our economies, but it's wiping out people. What about sleep apnea? Have you fixed people with that? Absolutely. We're not treating symptoms. Alzheimer's, Parkinson's. Okay, we know that movement triggers dopamine. Can we reshape the neck and correct dopamine production? Absolutely. Fibromyalgia. You've all worked on this stuff, but people don't know. Okay, in the adjustment time frame that you got that person in there, how much time do you have to explain to them that, yeah, we work on asthma. No, you're working on this guy for neck pain or back pain. Okay, now these are the most popular subjects. Okay, the most popular topics. How to achieve deep sleep. Good God, how many species on the planet can't sleep correctly? And we've got to tell people this. Depression and anxiety, cause and cure. Cause and cure. We talk about how serotonin can be increased, how serotonin is produced in the gut. Do your patients know that you fix this stuff? No. So the line's drawn here. This is how we fix this. First off, you've got to get out of your comfort zone. I'm going to show you how easy this is, but the planet is suffering. 1 in 2 people will get cancer in America. Yeah, the most medically oriented society the world's ever seen. 1 in 20 are depressed, 40% are diabetic, heart disease. Forget about the children. This generation's done. Okay, and I'm not being overly dramatic. If you have a species that 1 in 2 of the offspring have a chronic illness or disease that they will never recover from, that's the end of that species. Okay, why? I mean, what's going on in this hotel right now? We got the Mayo Clinic doctors meeting. Okay, I mean, I'm at the tiki bar, and I'm talking to the bartender who says, yeah, I got this bursitis, it's radiating down. My doctor told me. Does bursitis radiate? No. No. I said, okay, so I'm really politically correct. I said, well, your doctor's an idiot. I said, you're gonna have an unstable pelvis. You're showing me the L3 dermatome. You've got a mid-lumbar problem. I said, it's not bursitis. What do you do? Oh, he gave me Celebrex and a shot in the hip. Celebrex, oh yeah, that's a cousin of Vioxx, isn't it? That's a good pain reliever. Killed about 100,000 people before they took Vioxx off the market. This is a drug-sick society. We've got 8 more years left before 1 in 2 kids have autism. Now the tough part, there's a really good YouTube video. Oh, did I just mention YouTube? Okay, I go on there and I do research, and there's a virtual debate between Paul Offit for Profit, the dirtbag that's promoting vaccines. He actually says that there's no rise in autism, okay? I mean, this guy is so far deep in the hole. Well, he's virtually debated where they ask him a number of questions, and then Dr. Haley, who's a professor emeritus of biochemistry, okay, answers those questions. And you find out this guy is like a complete idiot. He's lying through his teeth or he's ignorant. But we don't have a choice. I mean, we're talking 1 and 2 and 8 years. Now, this violates biological law. This is, your patients have to know that if somebody has high cholesterol, does cholesterol have a function?
Yes.
Yeah. You produce every glucocorticosteroid, mineralocorticosteroid, and sex hormone out of it. It's most of your brain. If it's high, your body is, see, all doctors learn that the body is self-healing and self-regulating. But do we have that time frame in the adjustment that we have to explain it to them? No, we don't. But if we did a half-hour or 10-minute lecture on cholesterol and say, hey, you know, your doctor told you to take a statin drug, okay, and your muscles are sore and achy from taking the statin, and you probably don't know that your risk of cancer and Alzheimer's and dementia is increased by taking the statin. I did a talk on YouTube that took 10 minutes. Go watch it. Okay, would that be of value? And how long does it take? About 10 minutes. Okay, high blood pressure. Gee, that's good. Okay, is there any species that can't regulate their own physiology? Again, human beings are self-regulating and self-healing. How about a short little talk on deep breathing for 10 minutes, okay? It lowers blood pressure, or taking this blood thinner called hydrogen and oxygen. What's it? Oh, water. Okay. You know, antibiotics, yeah, increase in cancer. Prevacid, does indigestion come from too much acid or too little acid? Too little, I know. And this is all stuff, these are conditions that come into your office. Okay, you understand that? And all these conditions go away by changing this to that. Because we're not treating the symptoms, we're not diagnosing. This is what real chiropractic is. This is 19th century thinking, this is the 21st century. The gastroenterologist has no clue at altering nerve supply. Okay, you put that person in a sympathetic dominant state, what's gonna happen to the nerve supply to the gut? Shut down? Yeah. Nerve supply to the gut shuts down. What happens to serotonin production? Anxiety, depressed, okay, all of this stuff. Irritable bowel syndrome, yeah, he's gonna give a colonoscopy, okay, they're gonna give a cleaner that weakens and destroys the natural gut flora, that increases heart attack risk and increases kidney damage for no possible good. I mean, this is a dysfunctional system. There's only one system that ties this in. I mean, here's the editor of the New England Medical Journal. It's simply no longer possible to believe much of the clinical research that's published or to rely on judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I have slowly reached and reluctantly over my 2 decades as an editor at the New England Journal of Medicine. And if you're behind science and you like the double-blind placebo-controlled trials, have vaccines ever been subjected to them? No, because they're a public health measure. Does the public know? Do your patients know that vaccines aren't even based in science? Medicine, it's the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. I mean, when we look at this, do your patients know that it took you longer in school to get your doctorate of chiropractic than the medical or the distribution arm for the pharmaceutical industry? Because these are not really doctors. If you're drugging a symptom without fixing the cause, that's not a real doctor. Okay, when I told the bartender who had the bursitis yesterday, I said, I'll bet those guys aren't really doctors. I said, if they're ignorant enough to prescribe a non-steroidal anti-inflammatory, okay, like ibuprofen, Motrin, Aleve, okay, that destroys the building block of cartilage. Good God, that's not a doctor. And of course, guess what? There's about 4 doctors sitting in the bar. Yeah, I need to learn political correctness. Okay, this is what we are. The art, science, and philosophy. We are the largest drugless healthcare profession until the schools start changing that, which is psychotic, because drugs don't make you better. Explain to your patients through a video, because if you tell one person this, can you tell the 50 or 60 or 100 or 200 people that day the same message? No, you'd be exhausted. Chiropractic is not alternative healthcare. That's bullshit. Okay? Complementary? Hell no, I'm antagonistic. We are a separate and distinct healthcare profession that focuses in on the nervous system, which controls and coordinates every function of the body. The body is self-healing and self-regulating. Okay, where does an Advil come into that? Okay, where does a muscle relaxant? That's ignorant. We are not muscle or bone doctors. Yeah, I went to chiropractic.